and welcome to Chai Time with me, Lakshmi. India has the world's third largest HIV positive population. Today we're meeting an organization that's been quietly but very successfully working with this population, giving them longer life and helping prevent further infection. We're meeting Dr. Glory Alexander of Asha Foundation.
I was working as a consultant physician in a mission hospital. This was way back in 1987. And one day after I went into the hospital, after the weekend, I found a patient had been admitted there, examined him, and I was a little confused about what was really wrong with him. I knew that he had a bad lung infection, but I was a little concerned about the etiology of that infection. And as I left his room, he said, "Doc, do you think I could have AIDS?" And that kind of stumped me because I hadn't really seen a patient with AIDS before that, though we had heard about it, vaguely, but not really seen it in our country. That was my first contact with AIDS, actually. We lost the patient within 36 hours. But later on, we came to know that this patient knew that he was HIV positive, and because of the stigma associated with the disease in the US at that time, it actually come to India to die. It had an impact on me because I thought of a man coming all the way from USA and dying a very lonely, painful death in India. And then later on, about 95, 96, I started seeing patients in our own community who were HIV positive. And after we discharged them from the hospital, they would say, where do we go now? We've been kicked out of our families. We have no place to go. And I started thinking about it and said, okay, why not do something for HIV and AIDS? Gave up my full-time job and started Asha Foundation.
Tell me about the work at Asha Foundation, because I think from my understanding, you take a very holistic approach to dealing with HIV/AIDS, both concerns of infection as well as people who are already infected.
We provide the whole gamut of services, starting from awareness creation, prevention, treatment, care, rehabilitation, training, capacity building, and research. We also work in a very big way with prevention of mother-to-child transmission. The way we look at it is if we can prevent infection in a newborn child, then for that child will be 100% HIV negative for the rest of its life, unless when it grows up it has some risk. And we've actually been able to test around 1 lakh pregnant mothers, and we've identified about 645 positive mothers. And we've been able to bring down the risk of transmission in this group from 30% to 2.5%. So almost in around 98% cases, our children have been negative. This is our office. This is the room out of which the KNH-PMTCT project is run out of. The KNH-PMTCT project is one of our biggest projects, where we try to decrease the risk of transmission from a pregnant mother to her newborn child. And we are working with about 20 hospitals in the 4 southern states of India. So there's a lot of coordination happening at this office. This is Joyce Davis. Joyce is in charge of the adolescent health education program that we have. It's called Anmol Ashaएं, where we introduce moral education into various schools in India. Right now there are about 245 schools all over the country doing the program.
So when we say moral education, what all does it involve?
Okay. Basically it is a program where they try and tackle all the problems that adolescents face. And one is to feel good about yourself. That's very important, to know that you're unique. And the second is it talks about friendships, how to make out the difference between counterfeit friendships and genuine friendships. It talks about the difference between love and infatuation. It talks about prevention of diseases like HIV, AIDS, and sexually transmitted diseases.
It's amazing, isn't it, what self-esteem does to one's sexuality and choices in life.
This is Dr. Anuradha Nali.
Hello, Doc.
This is Lakshmi. Anu is in charge of our ICMR project, which is a research project on the growth and development of HIV positive children, where we are looking at the physical as well as the intellectual growth and social growth of children who are HIV positive. And of course, we are comparing it with 2 groups. One group is a group that is exposed to HIV but is not positive, and a group that has no link to HIV at all. This is the telephone counseling room, and this is Chitra. She's the project coordinator.
Hello, Chitra.
in charge of telephone counselling and other counselling services, and that is Dipti,
Hello.
who's a counsellor.
So how many
That is
calls would you receive, say, on a monthly or yearly basis?
On a monthly basis, it's about 120 to 160 calls. So in addition to all the other services that we provide for HIV infected and affected children and their families, we also have a clinic that runs on Mondays, Wednesdays and Friday afternoons. And this is the room where the doctors examine them. We pull those curtains and then we have 2 rooms here and 1 there.
It's fantastic to know of a non-profit organization which is doing such holistic work. Everything from research to prevention to counseling to support for people who are infected to preventing, mother-child infection. That's really a whole gamut of work. And then add to this the moral education.
Asha Foundation is one of the 25 charities which the Overseas Women's Club supports. This year we supported their sports day for the infected and affected HIV children. What touched me most was the way the staff interacted with the children at the sports day. It was really beautiful that they knew all of their names. They treated them as if they were relatives. The children enjoyed it so much. There was never any sense of patient or disease or any of these kind of feelings. And that really is Dr. Glory's vision. I mean, she's really driven this into her staff to advocate non-prejudice and non-discrimination. Instead of having a residential facility, she wants all of the people in their own homes with their own relatives. She has that vision to say with the correct medication, these people need not be treated like patients. And that's a wonderful thing that the whole of the city, the whole of the country should start to realize that people can be treated equally as anyone else. They just have some additional medications that they have to take, and that's it.
Some very holistic and impactful work there by Asha Foundation. If you'd like to support them, check them out at www.ashaf.org. Thank you for joining me on this webisode.